Welcome to Counterpoint. I'm Tanya Granick-Allen. Many parents out there are growing increasingly fatigued with all the yo-yoing of policies surrounding COVID. I know, I'm one of them. And every week it seems I have to explain to my children why their extracurriculars have been canceled this month, or why they can't meet up with this peer group or that peer group, or why they can't pre-register for any outdoor sports for the summer. It causes anxiety not just for parents, but for children too. And when we look at the science, the hard numbers of cases involving children, it really is becoming quite challenging to accept these restrictions as being grounded in facts. Medical advice has always suggested that there is no need for COVID testing unless you're symptomatic. Yet now, in many schools, voluntary asymptomatic COVID tests are happening. And God forbid your child tests positive, you might be required to isolate your child in a separate place in their home, away from the entire family, with no contact with anyone in the household. And perhaps what is most concerning is the deteriorating state of mental health of children in Canada due to the COVID lockdowns. A McMaster Children's Hospital report compared a 4-month period during the pandemic versus 1 year before, and has revealed some chilling stats. A 90% increase in referrals to its eating disorder clinic. Substance abuse disorder admissions have doubled, and youth seeking medical help after a suicide attempt has tripled. Is this surprising? Not to me. Most children thrive on routine and stability, and this past year has given anything but. And many children want to be in schools or with their homeschool co-ops, but around every corner, it seems there is another school lockdown and kids are sent to their homes. But is this fair to the children, to the parents who have to shift and adapt at a moment's notice? Are we really doing right by our nation's children with our COVID response? Well, joining me now to share their opinions on this matter is Dr. Scott Masson, a professor here in Ontario, and Anthony Furey, columnist with Postmedia. Gentlemen, thank you so much for taking time out of your day. You're both parents here in Ontario, so I guess first off, how's your family coping with these repeated lockdowns? Scott, how are you doing?
We're laboring under them just like every other family, as you can imagine. But when this broke out last spring and we went into the summer thinking about what we were going to do next year, we decided to pull our kids from the school because I anticipated that the government would do what it did up to that point, which is to double down on their original premise that they needed to take extraordinary measures and shut down society to save us all from this virus, and that they would be unable to slow the spread of a virus because it's simply beyond the capacity of any government to do that. And that as a consequence, my family would be thrown into one crisis after the next with arbitrary and ever-moving sort of boundaries for what will constitute safe policy going forward. So we tried to control what we could control, and so we're partly homeschooling in some ways, but it's been a deprivation for my children. For
Anthony,
sure.
Similar situation. Your children are feeling it as well?
Yeah, certainly. I mean, I'm grateful that we haven't had some of the more tragic stories that you're hearing out there that are very real for families. But, I think of how my youngest child just turned 3. And obviously, when you're a little baby, you don't really experience much of the world. So going from, just before turning 2 to 14 months later, I mean, that's pretty much all of his life as an aware human being. And he has missed so many experiences because of that, right. and missed really being able to have what is typical of a childhood. So even though we haven't had the more acute tragedies that you're hearing out there, I mean, we're definitely taking away people's childhood and teenage years. People who missed their sweet 16th birthday party are soon going to miss their 17th birthday party and so forth. And all that vibrancy of youth is being denied.
It is. And we see through this recent McMaster Hospital report that it is having a psychological and emotional mental toll on our youth. In the 45 seconds before we have to take a break, Anthony, I recently interviewed Lexi Dakin, a teen in New Brunswick who, because of COVID, it led to the deterioration of her mental health and she took her own life. There's a lot of stuff happening here. I quoted so many stats. Again, sorry, in the 30 seconds before we have to go and we can pick it up after. Is any politician listening to what's going on in this crisis? Anthony.
Well, they say they're listening. They say they're aware of the numbers. I've presented some of those stats to officials, live on camera during press conferences, and they nod and say, "Oh, yes, we're aware of it. That's why, we must soldier on," and so forth. And then they go on and they do introduce policies that do seem to exacerbate those very situations and numbers. So it should really outrage parents.
Yes, it will certainly outrages me. We're going to continue this discussion right when we return from this commercial break. Please stick around. Welcome back. We're continuing our discussion on youth and children in COVID, and has our approach been the right one? Joining me is Dr. Scott Masson, a professor here in Ontario, and Anthony Furey, columnist with Postmedia. Anthony, you just before the commercial break, I sort of gave you such a small period of time there, but we were talking about the mental health deterioration amongst youth. The stats are just staggering. They're jaw-dropping. I don't know what other hyperbolic word I can use. I don't think the politicians are listening. I don't know if it's because children are younger and then they don't need to say anything, or they can't speak for themselves, or they can't vote. I don't know what it is, but there's a crisis here, and I feel like that we are not addressing this. Maybe, Scott, I'll give you a chance to chime in here. When you hear these stats that I rhymed out, is this shocking to you?
No, I don't think it's surprising to anybody, although in a sense, there's no precedent for the government's actions in terms of locking down, incarcerating people in their homes for extended periods of time, and suspending the civil liberties that are allegedly part of the Charter of Rights and Freedoms that govern this country, and the goods that flow from that, from interactions, common human interactions of children with one another, so they can just play with one another on the playground, to see their teachers' faces, to be able to tumble about and to do joyous things like we did when we were kids. Mm-hmm. I think it's an outrage. Like I realize that I need to be measured on this. And to some degree, I try to be so for the sake of my family. But if adults will not speak up for their children when they're being abused by the government, who will? And the government also have children. I just think there is no precedent for the government's actions, and everything in the way that governments have sought to deal with crises like these in the past would suggest that we're doing exactly the wrong thing. We quarantine people who are sick, not the healthy. This is right. The way. So we're treating people who are healthy as if they are sick, and the consequence of doing that is obvious. Again, solitary confinement is a form of torture according to the Geneva Convention. There are people who are on their own, and if you're a child who's been diagnosed with COVID in some way, parents are supposed to isolate them from the family for 14 days. What manner of outrage is that? Like, who would suggest such a stupid thing?
Well, Anthony, you covered this in one of your columns. I don't know if it was you who discovered that this was happening, this policy that if a child does come back with a positive COVID test, there are certain strict recommendations by few actually public boards of health. What was shocking to you about some of these suggestions for isolation?
Public health likes to say, okay, if there's a potential exposure, if you're getting off an airplane, if you've come in from another jurisdiction, self-isolate for 14 days. And other jurisdictions have reduced that to fewer days and so forth, but that's kind of their go-to. And when it comes to children who may have been exposed to a coronavirus case, not that they have it, but they came in contact with someone who tested positive, they were sending out letters saying, okay, your child has to be home for 14 days. And some public health units, particularly Peel Region, was saying, and they need to stay alone in a separate room by themselves for those 14 days. And they made no indication that this did not, that this only applied to, older children, teenagers, or what have you. It would be unacceptable even if that was the case. But small children, this letter also applied to. And I must say, I've done a good job keeping my composure throughout this year of insanity. But when I heard from one parent who had received that letter, and say it applied to their special needs son with Down syndrome, that he needed to be kept in his room for 14 days alone. Obviously, tears have to well to your eyes. This is just, to Scott's point, I don't know what the term is, outrage, what it is. Why Ontario parents in particular seem to be less incensed about this than people across North America, I don't know. But this policy seems to be unique to Ontario. Some public health regions have gotten rid of it, but it's similar messaging still persists.
Yeah, it's quite strange. But to put things in context, 1 out of 3 Canadians lives in Ontario. So this is a good chunk of the country that is engaging in what I would suggest are asinine policies for isolation. Okay, well, schools seem to be closing again. We'll talk about that because kids are in schools, private schools, public schools, whatever. But anyhow, so public school closures seem to be a thing again. Quebec has shut down its schools in various cities. Now Ontario is followed suit recently with one of the largest school districts in the Peel region. Now following probably the largest school district, Toronto is now suggesting it's shutting down, or it is. $1 million question, and maybe I should tease this and we continue after the break, but we're going to talk about, do school closures actually stop the spread of the virus? And I think this is a very important topic because when we're talking about disrupting families, not just the children who have to be staying home, then you have parents who cannot go to work and they have to stay home and take care of this child if there's a lockdown, and then they have to make sure that they're doing their synchronous learning or their asynchronous learning. There's a lot that goes into it, and it really is almost like throwing a grenade in a household. It just disrupts so much. So we're going to talk about that right when we return from this commercial break. Welcome back. We're discussing COVID response as it relates to children, especially in the context of school lockdowns that seem to be happening across the country. Again, joining me is Dr. Scott Masson and Anthony Furey. Anthony, before the commercial break, I really teased this topic, but I think the number one question on most persons' minds as we see that lockdowns are, basically schools are shutting down now again, is, well, does shutting down schools actually stop the spread of viruses? So, could you answer that for me?
Yeah, there's a very interesting fact out there that I think most people are unaware of. When the Ontario government reports cases in schools, and whatever the number is that day, a couple hundred or so forth, parents go, oh no, these are, cases that are being acquired in the school. Maybe it could be my son, it could be brought back home and so forth. It actually doesn't mean cases acquired in schools. It just means people who attend the school setting have tested positive for coronavirus. So, okay, how much of actual acquisition is happening in the classroom? I put this question to Dr. David Williams as all these school closures were being announced, and he maintained that consistently for many months it has been the case, and even now with these new variants they're discussing, that there's been very few cases of actual in-class transmission throughout the entire province since the whole pandemic began. It is unbelievable, really, that this information, and really, I guess, the misinformation that leads people to believe otherwise, hasn't been put out there more, because that's, those are the facts. I mean, I guess a child acquires it from their parents or whatnot, and they do go to school, but then they test an entire classroom and they find that the child has not transmitted it to anybody else.
Right. And I mean, if you look at the protocols in place in classrooms, the teachers are wearing face shields plus masks, kids are socially distanced, some have these plexiglass dividers. I mean, there's a lot going on there. So I guess then the follow-up question I would have liked to ask to Dr. David Williams, I'm not sure if you had that opportunity, is, well, that if it isn't the case that transmission happens in schools, then why are you locking them down? Does anybody have an answer to that, Anthony?
Well, he gave a bit of an answer that Peel and Toronto were closing schools because, well, this gives them the opportunity to get up to speed with the testing, and maybe there's some transmission now, so they want to figure it out and so forth. Basically, I think for parents who would like to see schools remain open, it wasn't a very acceptable answer.
Right. And Scott, do you have any thoughts on that? Why are they locking down if it's really not a problem? There are no transmissions, very few transmissions in schools.
Well, it doesn't seem they're following the science, does it? So again, the trope of the politicians that they're just letting the health officers follow the science and they're not scientists falls flat when the scientists say that the science doesn't back the lockdowns, but nonetheless they're going to lock down. So at this point, the rabbit's chasing its tail, and we're wondering, well, what's going on here? And parents they ought to be expressing their outrage.
Right.
Public health officers may not respond to politics, politicians do.
Right. And maybe more of us parents need to be more outraged, at least vocally, or I don't know, are we even allowed to gather in public places, or have those rights been quashed too? I don't even know. Okay, Anthony, recently though, speaking about following the science and the experts, you highlighted that there are 300 healthcare professionals that have called for an end to school closures, and these were health professionals here in Ontario. So an end to school closures in Ontario. Was that met with any kind of openness, or, I mean, clearly it seems to have fallen flat? I don't know.
Well, it seems like the government would really like to keep schools open, but they're up against all these other voices who are pushing to the contrary. You've got teachers' unions who I guess have a bit of a power play going on, and you have ICU doctors who are really kind of acutely focused with the stresses that are very particular to their environment. They'd like to see everything shut down. But pediatricians, really none of them support schools being closed. And any sort of medical professional that is taking, I think, a holistic look at broader society,
Right.
they all have a lot of concerns and generally want to see a more balanced and targeted approach in terms of how we address these things.
My concern is that in the future, I mean, it's not a concern. It's just, I guess I'm thinking out loud here that in the decades that follow, that some child will turn back and say, well, why did you allow this to happen, mom, dad? Or why did the government allow this to happen? My mental health deteriorated. I missed out on so many things and it was not justified in hindsight, my goodness. And, I'm wondering what the future will hold for this. Again, we're going to talk about more after the break about testing. One interesting fact or data in evidence that you provided, Anthony, was that in the Ottawa Public Health, in those schools that they did a pilot project for testing, there were 1,904 tests and only one positive. That was, for me, a very jaw-dropping piece of data. I didn't think that there would be so few positives. Am I right to be shocked by this? Anthony?
Yeah, and I wrote another report about a new variant case that was detected within one Toronto school, and then they tested all 300 kids in that school. Zero positive cases detected. So you've got to ask, what is the utility of all this mass testing when it's really yielding nothing right now?
Yeah, no, it's definitely a good question. And after the break, I do want to, we were going to wrap up this whole show, but I want to talk about the voluntary asymptomatic testing in schools. I find this a little unnerving for me as a parent. We'll talk about that right when we return from this commercial break. Welcome back. We're wrapping up our discussion on the COVID response as it relates to children and in particular in schools. Again, wrapping up and joining up this discussion is Dr. Scott Masson and Anthony Furey. Okay, voluntary asymptomatic testing in schools. So this is a new thing that I've discovered that has been going on, and letters have been going home to parents in various school districts, specifically here in Ontario. I've seen it from at least 3. You follow it on Twitter, and some even doctors with children in school systems are speaking out against this. So I have an issue with this. For me, I like to follow the medical advice, and medical advice to date has been that children do not require testing if they're asymptomatic. So why is this going on? Why now? Scott, do you have any thoughts on this?
No, I have no idea other than that they want to extend the crisis for ulterior motives, which could be speculated upon, but it doesn't make sense that Ontario is being locked down when the United States is being opened up. I mean, just yesterday there was a Blue Jays game in Texas, full stadium. The juxtaposition of those two events could not make a more crass distinction between the actions of our governments and the accountability of public officials to their populations. We do not have accountable government in Ontario. That's what it seems clear to me.
And I agree with you. I saw that news headline myself, seeing that full packed stadium in Texas. I didn't know whether to laugh or cry. It was just so shocking. I'm like, oh, that's a thing? People do these things? They get together in large groups? Wow, it seems like it's been so long. But with respect to testing, so as a parental rights advocate, I've always been very careful about making sure that there are no medical procedures or things like that happening with respect to children without a parent present or without their explicit consent. I do understand that this testing is voluntary, but I have an issue with this. I think that this kind of testing, or any medical testing for that matter, should only take place in the presence of a parent, especially in this pandemic situation, in the presence of a parent, after solid advice by their medical doctor. I don't want to be sending my kid to a school and having them voluntarily swabbed, or maybe the child will consent on their own. I mean, technically, if they have capacity, they can. Am I being too alarmist here, Anthony?
Well, I don't think so. When we look at all the pediatric experts saying, look, kids are not getting coronavirus in any particularly serious way. Their hospitalization rates, their death rates are actually lower than they are for influenza. And they're not believed to be the super spreaders that were originally thought. So why are we scapegoating children? Maybe it's because we just see them walking to school and it's the only thing we can see, and that makes a visual in the news. So we say that's the problem. Meanwhile, there are people going into warehouses and factories that are causing outbreaks, but there's not a moral panic about all of that. It is very inconsistent. And And yeah, it's definitely exposing children to way too much more needless antics than they need to be subjected to.
And in the time of hyper emotional mania around COVID and in a negative way, I mean, we've seen the stats about children's mental health declining. The last thing I think we should be subjecting children to is this asymptomatic testing. Scott, where does this end? We've just over a minute before we have to wrap up the show. What should parents be doing? What should they not be doing? How can we better advocate for our kids when the future here, at least in the short term, looks so bleak?
Parents need to start getting vocal, and they need to start contacting their elected representatives. And if that fails, they need to go out on the streets. The truth of the matter is that any measure of a just society is based on how we treat our most vulnerable, and our children are our dependents. They are minors. They are not able to defend or advocate on their own behalf, and they are being faced with measures which are clearly, scientifically, demonstrably against their best interests, and they are at no risk. They are posing no risk to the general society, as Anthony has admirably cataloged in his columns. And yet they are still being subjected to lockdowns. They are the most vulnerable. They are the ones that are most suffering for this, not only in the present, but they'll also bear the debt load of locking everything down as well. So this is demonstrably harmful, and I think it's monstrous. That's what I would say, though. People need to get loud now and act very un-Ontarian and man up. Act like people. Come on.
Okay, we can do that. All right.
Here.
Thank you. Thank you both for joining me. I really appreciate it. And hopefully we won't have to talk about this because things will just get better very soon. I don't think that's in the cards, though. But thank you very much for joining me.
Thank you.
That was a lot to handle because it's when we talk about our children, they are nearest and dearest to us, and they need advocates. And who is better to advocate for the health and well-being of children than the parents themselves? So take up the cause. Call your politician. If you don't like the lockdown, say something. Do something about it. Because again, who's better to advocate than you for your child? For Counterpoint, I'm Tanya Granick-Allen.